Hello guys, in this video we are going to decode an important and high-yield topic measles through a powerful clinical case that ties everything together. But before we begin, if you are new here, don't forget to hit the subscribe button for more smart simplified medical content. I am Dr. As turning stress into success. Let's get started. A 3-year-old unvaccinated boy is brought to the hospital on day 4 of illness. His parents say he had fever for the past 3 days, along with runny nose, dry cough, and red eyes. On oral examination, you spot teeny white lesions on the inside of his cheeks. At the same time, a red maculopapular rash appears behind his ears and spread down to his neck and chest. Let's break it down, starting with the basics of measles. Measles is caused by the single-strand RNA virus belongs to Paramyxoviridae family, which spreads through airborne droplets, and it's one of the most contagious viral infection known to humans. Now let's look at the early warning signs. Before the rash appears, measles typically presents with the classic triad, the 3C's: cough, coryza, conjunctivitis. These prodromal symptoms are your earliest clinical clues. Okay, but what about those teeny white spots in the mouth? Yes, that is Koplik Spots, one of the classic findings in measles. These are teeny white lesions with a reddish base found on the inner cheeks opposite to the molars. They appear before the rash and they are so unique that they are considered pathognomonic, which means if you see them, it's almost definitely measles. But measles isn't just about diagnosis, right? You need to watch out for complications. The most common complication is acute otitis media, which may present as ear pain or discharge. Pneumonia is another serious concern and the leading cause of measles-related deaths. And finally, the most dangerous SSPE or subacute sclerosing panencephalitis, a rare fatal brain disorder that occurs years after the initial infection. Let's get back to the rash. How does it actually spread? As we saw in our case, the measles rash typically starts behind the ears or on the face, then spreads downward to the neck, trunk, and limbs. It's a maculopapular, non-itchy rash that often becomes confluent, especially on the face and upper body. Key point to remember is the rash usually appears around day 4 of illness, just as the Koplik spots begin to fade. Now, how do we treat measles? Treatment is mostly supportive, plus vitamin A, which reduces complications and mortality. But prevention is always better, right? So, the MMR vaccine, which is a live attenuated given at 9 months with a second dose between 16 to 24 months. It's contraindicated in pregnancy and also in immunocompromised individuals. Okay guys, let's test what you have learned. MCQ time. A child admitted on day 4 has 3C's, Koplik spots and a descending rash. What is true? Option A. Rash starts on legs and ascends. Is that correct? No, the rash starts behind the ears or on the face and spread downwards. Yes, so it's descending, not ascending. Option B. Koplik spots appear after the rash. Nope, it comes before the rash. They usually show up around day 2 or 3 of illness and disappear as the rash begins. Option C. Pneumonia is the most common cause of death. Yes, that's correct. Pneumonia is the leading complication and the most common cause of mortality in measles. Option D. Vaccine is given at 3 months. No, it's not correct. The MMR vaccine is a live attenuated vaccine and it's given at 9 months followed by a booster at 16 to 24 months, not at 3 months. So the correct answer is C. Pneumonia is the most common cause of death in measles. Super high yield guys, so don't forget this one. I hope you not only learned but also locked in the key points about this critical topic, measles. If this video helped you, give it a thumbs up and don't forget to subscribe for more high-yield medical content. This is Dr. Ask turning stress into success. Thank you. Bye-bye.